Doctors of Reddit, what's the stupidest patient you've ever had? Story 1. Well-known hypochondriac patient goes to a neighboring hospital, and for some godforsaken reason, they put in a temp Foley catheter. Cue this man finally feeling vindicated that he is on his passing bed. He comes in daily to tell us that his urine changed color, sometimes it lighter, sometimes darker, and the changes directly relate to his water intake. To him, this equals cancer, Ebola kidney failure, MRSA. Foley was removed, so he's back to his weekly passing omens rather than daily. Story 2. I worked as a patient care tech in a hospital. I had this patient that was diabetic and had been for the last 30 years of his life. I check his blood sugar level after breakfast and it's super high, like 3 times the normal amount. I ask him what he had: fruit, bread, and coffee with artificial sugar. He was shocked and thought that just because he didn't have real sugar, that his blood sugar was almost to the point of him passing out. Lots of food are processed as sugar in the body. Story 3. 1. Patient was given small camera the size of a large pill to look for GI bleed. It is disposable, and the pictures are stored on a belt-like device. Upon reviewing the film, the pill had taken 2 trips through their GI tract. Patient ate the camera, shoot it out, then ate it again because it went through too fast the first time. 2. Patient, not same as above, comes in with GI bleed wanting to be admitted. Checked their stool and blood work, and it shows no sign of bleed. Spoke to patient and told them this, and they said, "Hold on." I re-enter room an hour later, and patient shows me a picture of their anus on their phone with a blood all around it, bright red blood. I notice patient is hiding their hand, and I ask to see it. Patient had cut their finger, smeared the blood around the anus, and taken a picture of it in an attempt to be admitted. 3. Yet another GI bleeder, again not above, come in for vomiting blood. Again, labs don't indicate this, but don't always do. Walk back into room, and patient vomits bright red blood. Visit room again an hour later, and I see patient gagging themselves, and then bright red blood comes up right after they come back from restroom. Quick glance into their open bag shows empty test tube that used to contain blood. Patient is drinking blood, I presume their own, and self-inducing vomiting in order to be admitted. Story 4. Put a very expensive, implanted device in a patient with government-funded care. She came to the follow-up appointment with a gaping, wide infected wound. Said she thought it would help healing if she had her dog lick it. Device had to be removed and discarded. Story 5. Paramedic here, called for a diabetic. I get there, and the patient is an older gentleman who is laying on a bed with what looks like a white mask on. I ask what's going on, and the family goes on to explain that he's a diabetic, and the doc told them to give him frosting if his sugar gets low because the sugar content will perk him up. Turns out he didn't explain that they should put it in his mouth. That's right, they put a white frosting mask on this poor guy. Shocker, it didn't work. Story 6. I'm not a doctor, but a respiratory therapist. I've known of patients in their 20s coming in for endocarditis after shooting up Opana, then getting a heart valve replacement. Here's where it gets dumb. They kept shooting up Opana after the surgery and came back to the hospital with a fudge-up heart. Story 7. I am not a doctor, a nurse, or a medical student, but 3 years ago, my MIL was diagnosed with mouth cancer. Prior to that, she was a 2-packs-a-day smoker. She, my FEL, and my husband are adamant that smoking had nothing to do with her getting mouth cancer. They were convinced it was only her genetics. Story 8. Obligatory, not someone who works in healthcare, but a friend of a few nurses that work in one of the very few clinics in my city that bulk bill. Their clinic has not only doctor's offices, but a few small surgical rooms for minor procedures. One day they had a meth addict come in complaining about a sore female body part, needing to investigate to find out the cause of the pain. The doctor and the nurse that told me this story escorted her into one of the surgical rooms and asked her to change into a gown. What happened next made my friend, who normally has a cast iron gut, to vomit into the sink inside the surge room. Apparently, this lovely lass was a adult worker on the side and had attempted to clear her lady garden with a razor and no brain cells whatsoever. Not only did she take off the very tip of her clitoris, but she also shaved chunks out of her labia. Now this on its own wouldn't make my friend vomit. What did make her vomit was the part where the patient had left this gross mess for almost a week and a half and had continued to take on clients in the meantime. So not only did her female body part look like something from a slasher movie, but that was mixed in with a nasty infection and Joe Bloggs and his friends' semen samples and smelled like a sewage system. When asked why she didn't get to a doctor sooner, she simply said, "I thought it was fine until it started hurting." Story 9. My wife is an RN who works at an outpatient surgery center. Cataract surgery is one of the common surgeries that they do. Patients are told that after the surgery, they should put eye drops in 4 times a day for 1 week, so 28 drops altogether. One patient asked if it would be okay to just put the 28 drops in all at once so they didn't have to deal with it for a week. Story 10. I once had a child who swallowed a sizable magnet that passed to the intestine, and we were just waiting for it to pass in the stool. The next day when he came for follow-up, we just found out that he swallowed another one that got stuck to the first magnet in the intestine through the stomach wall, resulting in intestinal obstruction, and he was transferred to OR immediately to have them surgically removed. Story 11. Not a doctor, work with them. The episode I can't forget is the time a patient with established coronary artery disease and current chest symptoms was in having an imaging cardiac stress test, and he sent out for a large cheesesteak calzone to be delivered to him between the stress and rest portions of the exam. Story 12. There was a 24-year-old patient who was brought in from a jail in a rural county. He was working roadside cleanup when he found a bottle in a ditch that he thought contained adult beverage, and he quickly chugged it down. To be fair, it did look like whiskey. It wasn't. It turns out it was a substance that contained sulfuric acid. Its pH was less than 2.5. It just ate up the litmus paper. So shortly after he gets to the ICU, he is in excruciating pain and vomiting blood. The gastroenterologist took him to do an EGD, basically a procedure where they can look at the esophagus, stomach, and duodenum with a camera attached to a flexible tube, and the pictures were horrendous. You could literally see his stomach and esophageal mucosa eroding away. He had to be sent off to another hospital where they had an esophageal surgeon who could repair the mess. He, of course, needed multiple surgeries and had a very long hospital stay. I saw him a few months later when he was admitted for another issue. He was down to 90 lobs from about 150 and was getting fed through a PEG tube. He was very lucky to be young and otherwise healthy, but obviously not very smart. Answer: my brother-in-law has a similar story. He is a pharmacist in a hospital. One patient got tar, I think on his male body part, and in trying to get it off, used something highly corrosive. He read the warning label to wear protective gloves, and so he did before applying it directly to his male body part. Edit to add, I don't remember all the details. It may have happened the whole working construction while being an idiot. The only part of the story I remember clearly is where he read the label, put on gloves, and then used the highly corrosive stuff on his male body part. That level of stupid is hard to forget. Story 13. A guy had a really sore jerk or something. IDK, I came late to the party. The nurse had him lying down and told him not to get up or try to go to the bathroom. He did it anyways, and a weird brown liquid started to drip down his leg. Turns out he keistered a root beer bottle. Story 14. Irate mom who wanted to speak to the doctor because we took an unauthorized urine pregnancy test on 16-year-old daughter just before x-rays. I never consented and now she's traumatized. Explained that it is standard in females of childbearing age and that consent to treatment was signed upon entrance to facility. Not good enough. They were rich Southeast Asian, and I suspected that this routine standard was perceived as an insult to their status. Story 15. Not really stupid, but easily influenced. If there is anyone to blame, it's the quacks that take advantage of patients like these. A 63-year-old gentleman with coronary artery disease, all key ABGD up, DM, dyslipidemia, HTN, came into the cardiology clinic for a follow-up. His LDL, the bad cholesterol, is through the roof. With so many comorbidities, we would like to keep it very low, as he had already had a major myocardial infarction. So, we ask him about his medications, and he has of course stopped taking his statin because the lady on the television, who is a famous figure in our country, said that they were bad for you and that they were a plot by Big Pharma. She also apparently told him to eat 0 carbs and lots of fat, and he had bouts of hypoglycemia because his medication was not adjusted for it. So after spending almost half an hour to convince him that statins were okay, aside from their actual adverse effects, we sent him on his merry way to endocrinology. That was a rather frustrating experience. The worst thing is the TV lady is actually a professor of cardiology who turned into a TV personality medical quack dietitian after discovering that there was money to be made. Story 16. I had a fella come into the ER who was stone sober, but only because he had spilled all of his rubbing adult beverage onto his pants, which meant he couldn't drink it. The reason why he was in the ER, if the first place was because he tried to burn the adult beverage off of his jeans by lighting the adult beverage on fire, thinking the adult beverage would burn and not his pants. He had some pretty rowdy burns from the calves down because he couldn't get his pants off of his shoes. To be honest, pretty nice guy. Absolutely the kind you'd expect to light themselves on fire, but he was very pleasant considering the circumstances. Story 17. Had a guy come into the ER for hiccups yesterday? LOL, edit. I just got a million messages as to why hiccups almost eliminate people or some guy they know. Holy crap, this was not the case. No acute symptoms, no abdominal or thoracic complaints, no pain, no SOB or dyspnea, no abnormalities, normal rad exams. He just came in because he was hiccuping. He was not dying. It wasn't a vagus nerve tumor or acute pancreatitis. It was hiccups. Just hiccups. Calm your tits, Jesus, Elmo. Story 18. A 20-year-old girl came in with abdominal pains. We did a pregnancy test. She was pregnant. She acted surprised because she was on the pill. I asked her how long she's been on it and if she had been taking it daily, as prescribed. As if it were the most logical thing on the planet, she said she did not take it daily because she did not have intimacy daily. I looked at her trying hard not to laugh. She only took them right after she had intimacy with her boyfriend, so like maybe a couple of times a week. Story 19. Oh, fudge, if we're talking stupid ED visits. A woman came in because she got stung by a bee, not allergic, and no reaction. It just hurt. A woman brought her kid in because he got stung by a bee, not allergic, and no reaction. An entire family came in because they found a dead mouse in their apartment. Woman came in for a second-degree burn on her arm that was roughly the size of a Tic Tac. A woman spent like 5 minutes explaining to me that because of all the vaccinations we give dogs, we're seeing a rise in doggy autism. I like to call it pawtism. Answer: I once went to the ER because I had a mild allergic reaction to a bee. It was in the middle of the night, and I didn't really want to be there. I just had some red dots on my skin and everything itched. I felt like some of the staff, though. Why is that guy here? He's okay. But I lived alone and really didn't want to take the risk of waking up without the ability to breathe, so I can understand being a bit scared there. Story 20. Not a doctor, but a friend of one. So he said that he got a call that said a parent had come in with their daughter who was having a seizure. He rushes out to the waiting room or wherever you take people having seizures. He sees this dad in a sort of panic. He looks at this girl who's maybe 12 to 13, and she is shaking badly, as in obviously fake, and just keeps doing it. Calmly walks up to her and asks what's wrong. She answers in a perfectly level and steady voice, "I'm having a seizure," while continuing to shake, which was more like a weird side-to-side motion. Anyways, she faked a seizure to get out of going to school. Story 21, NAD. However, recently talked to a patient that is getting ready for surgery that involves usage of robotic arms to help remove the tumors, allows for smaller incisions and greater precision. This patient starts insisting to meet the doctor when it seemed like the consult was wrapped up. So we get him back in there thinking maybe she's got another question. The patient says, "I still want to meet the doctor." And the doctor points at himself and says, "I'm the doctor." Patient: "I know you're a doctor, but I want to meet the doctor." Doctor: "You've already met the resident." "I'm the doctor doing your procedure." Patient: "No, not you. I want to meet the robot that's going to do my surgery. I feel like we should at least shake hands first." Apparently, the patient was expecting some metal man to walk through the door. The patient also had cancer cure recipes and was insistent we take notes. Story 22. No, an emergency patient. I did just have a chiropractor tell me he had more training than a medical doctor. I changed the subject to something else. I'm an eye doctor, and when I was looking at his retina, I found a new choroidal nevus, essentially a mole, almost always benign depending on size, elevation, location, and a few other factors. He asked me what supplements I'd recommend to make it better or stop it from worsening. Took everything in me not to roll my eyes. On another note, yesterday had a patient walk in over the lunch hour. It's always Friday when these ones walk in, the ones with serious problems that they should have seen someone months ago or weeks ago but didn't because they thought it to go away. His vision had been worsening and distorting. Finally wanted to get it looked at. Giant choroidal melanoma. I'm sending him to a specialist, but I'm afraid at best hell lose his eye. At worst, hell have a few more months. Would have had a better prognosis had he come in months ago. Don't just wait for problems to resolve on their own, guys. Story 23. Respiratory therapist here was working ER and was told we were getting a patient in respiratory distress. When she gets in, she is having problems breathing and need oxygen. I'm placing an oxygen mask on her and she yells, "I'm allergic to oxygen!" I heard the doctor laugh behind the curtains. Story 24. My aunt went to see her gynecologist during her pregnancy, and she was asked if she had any surgeries done recently. And she said, "They did an autopsy on me once." The doctor stuttered and said, "They did a what?" She repeated it. From that point on, the doctor only conversed with my uncle. Story 25. Friend of mine is a gynecologist, and she told me that once she had a patient come in and tell her that she cannot have intimacy anymore because her partners complain that her hoo-ha stinks really badly, but she's never noticed. So Doc asks questions like, "Have you been using any new soaps, creams? Are you allergic to anything?" And the patient said no. Doc examines patient's vag, and the smell is unbearable. She suspects a major infection. Then she realizes that she cannot see inside properly, and she grabs her tweezers, IDK the proper name, and prods. She hits something cushiony. She starts to pull gently and extracts a tampon, a month-old tampon which was black and green and smelt foul. Patient says, "Oh, I thought it has fallen out when I had my last period." Story 26. Couple of stories from med school residency rotation in a rural area of the state. Woman brought her kid in because he'd been sick for a while. Examination didn't reveal any issues at all. Kid looked totally healthy. When told the kid was fine, she looked at the kid and says, "Dang it, I brought the wrong one." Then there was the mom, who upon being asked her kid's name, thought for a moment, shrugged and said, "I can't remember, my husband named him." Story 27. I was at the children's hospital with my eldest when he was a toddler. The day we found out he was allergic to penicillin, when the bed next to me was suddenly occupied by a rushing team with a limp, unresponsive infant. This was a hot day in midsummer. The baby was in a full Canadian winter-level snowsuit. After they got the baby's temperature down, I got to overhear the doctor lose his mind a little bit with the mother as she kept insisting she had to have her baby in the suit, lest the baby risk feeling chilly. He explained that the minor discomfort of having to cry for a blanket did not trump the risk of passing and possibility of literally frying the kid's brain. He had to get quite nasty with his wording that she had almost eliminated her baby and might have given it brain damage. Story 28. Not a doctor or nurse, but patient care assistant. Guy came in for traumatic brain injury because he tried to rob a taxi driver and the taxi driver ran him over. This man had to wear a helmet at all times, but went outside to smoke, remove it, and lay on the concrete ground. He had a piece of skull removed to alleviate pressure, so any ounce of pressure directly to the brain would eliminate him. Story 29. One of those by-the-way requests at the end of a visit back in residency. It was about erectile dysfunction. I asked, "Do you have trouble getting an arousal or keeping your arousal?" To which he replied, "Nah, doc, I don't think you understand. My male body part just won't get hard." Story 30. Not a doctor, but I'm in the army and hang around with medics a lot. The worst I have heard of was during the initial invasion of Iraq. One guy was dared that he can shove a grenade up his jerk. He did. They had to set up a small surgical room, and a mix of doctors and EOD had to get it out. Story 31. Not a doctor, but a stupid patient. I noticed there was a lumpy thing in my female body part, and naturally, I got worried. What you need to know is that the intimacy ed at my school was canceled halfway through as my teacher quit, so I never learned a lot of basic shoot. Fast forward a few weeks and I'm real stressed out about the lump ordeal. I call a gynecologist and book an appointment. When I get there and explain my symptoms, she chuckles and tells me that the lump is actually just my cervix, and I realize how much of an idiot I am. Story 32. Not me, but my dad, dentist. He told me of a woman that didn't want to come to us because we don't use titanium for the screws. We use zircon oxide, one of the only dentists in the world that uses zircon instead of titanium. After we went through an argument of 1 hour, she still didn't want to come to us because there is no scientific proof edit. Forgot to mention that we showed her how much impact titanium can have if worn over 10 years inside of the jaw. Story 33. Work in ED, called the ambulance for chest pain. Was just upset her husband went to the TAB, gambling, without her father-daughter combo. Convinced they had chicken pox, they had been outside fishing in the evening around mangroves and were eaten alive by sandflies. Came in hunched over in pain and crying, claiming abdo pain. Didn't like the flavor of his meat pie and wanted it out of his body. The old sunburn trick, and forgot to put it on, and they suffer sunstroke. Drinking last night and expect us to cure their hangovers. Story 34. Had to explain to a nurse that what she is seeing inside her daughter's ear on a otoscope is normal, cone of light, and not a pimple as she had thought initially, and that she should not pop it with a needle as she had originally planned. Edit. She was my nurse at the time, I'm a PA, texted me the night before saying she found a pimple in her daughter's ear and that she was going to pop it with a needle. Called her immediately and told her to leave it alone and bring the child in the next morning for me to look at. Story 35. My daughter is a psychiatrist and she's told me many a story. She has a mother, bring her 8-year-old son in and insisted he had oppositional defiant disorder. She said she diagnosed him with being a regular 7-year-old who didn't want to do things he didn't understand the benefit of or sit still when he could be running and playing. She basically said it was because she didn't want to be judged as a bad mother for having a poorly behaved son and wanted to be able to attribute his behavior to an illness. She came back again after 2 other doctors refused to diagnose him. So my daughter explained to her there were parenting classes she could take and that the answer was not to have her child formally diagnosed with a psychiatric disorder on a record that would follow him the rest of his life. She asked if she could see a different doctor at the hospital. Story 36. Paramedic here. We had a patient recently call the ambulance because a tiny amount of blood had seeped through a Band-Aid that was covering the smallest cut on his toe. He kept saying, "I'm going into shock." Never thought I would have to explain the structural limitations of a Band-Aid to someone. Story 37. MD here. Saw a young woman in the emergency department. Her primary complaint, per the triage nurse's note, was lethargy, but she was awake and alert when I went to see her. I told her that she didn't look lethargic, and most patients who are lethargic come by ambulance rather than walking into the ED, so I was wondering what she meant. She started to tell me, well, last night while I was sleeping, and I interrupted her because of course people are a bit lethargic when they are sleeping, but I caught myself and asked her to continue. She then tells me this story. So last night when I was sleeping, I was talking in my sleep. People have always told me that I talk in my sleep. My family, roommates, So anyway, I was talking in my sleep and I was saying, "Mary," that's my roommate's name, "Mary, wake me up." And it was really hard for her to rouse me from sleep. Me. "And that's why you're here today?" Her. "Yes." Story 38. I worked at a pain management clinic. In an attempt to combat opioid use addiction abuse, a lot of patients were prescribed a medicated cream. It looked a lot like sunscreen, and you just rubbed it onto the hurting areas. I watched the nurse carefully and slowly explain how to rub it onto the skin, using small, uncomplicated words and going through the motions of applying it several times. But every so often, patients would complain that their cream tastes bad. Story 39. Obligatory, not a doctor, but my younger brother is actually very bright, but just often time refuses to apply himself, use his brain. His senior year of high school, he had a hernia in one of his testicles. Basically there was like this excess fluid in it. He brought it up at the doctor. When he first noticed it was a bit swollen and larger than the other one. Doctor said it was all right for now, but if when it gets worse, come back immediately. For some reason, only "it's all right" registered inside my brother's head. Apparently it got to the size of an avocado before he brought it up to anyone and went back to the doctor and get it surgically treated drained. Story 40. I'm a CNA, not a doctor. With that being said, the other day a patient was telling me that they want the doctor to prescribe them heroin. I told him I'm pretty sure they can't prescribe anyone heroin. Being new to the field, I have learned the opioid epidemic is a very real thing that affects an insane amount of people. I knew it was bad, but I didn't think it was this bad. Answer. In my country, heroin addicts who cannot follow a methadone treatment failed. Other attempts at getting away from it can be prescribed heroin. They get it in a controlled environment with clean needles together with psychotherapy, social services, treatment for other stuff they often have. It is called heroin-supported treatment, has been pretty successful in crime reduction and improvement of health of severely addicted people. Story 41. Nurse at the moment. Someone shyly told me she had seen a story on Facebook about a girl who had gotten pregnant from her flu shot and wanted to know if that could really happen. I wish I'd had more practice at controlling my face at the time because she was so earnest and unsure about it. At least she had just enough doubt to ask, right? Story 42. I really hope this doesn't get buried, BC, it's too good. I'm an RN, and I had a family member of a patient who kept trying to go outside and smoke. Our facility is very strict against smoking, so I told her I frankly cannot allow it. If patients leave without our consent, it will be considered leaving AMA, against medical advice, and they won't be allowed to come back to our unit, trespassing, 500 fine, etc. She told me it was discrimination. BC, she has a real medical condition where she physically has to smoke cigarettes. I chuckled and said, yeah, I know addiction is real, and goes on saying how rare it is, how only 3 of the population has it, aka super rare, and if she stops smoking, she will get ulcerations in her mouth, esophagus, and lungs that will weep and cause her to drown. She was diagnosed by the 30th specialist physician she saw. None of the doctors at Mayo, Johns Hopkins, or Stanford could figure it out, but thankfully, a doctor right here in states our little normal town with mediocre healthcare, was able to figure it out. I wanted to say, was it a psychiatrist? It's so rare that they don't even have a name for it yet. Like, how fudge stupid do you think I am? I went to college for 8 years, 2 4-year bachelor degrees, and I work in healthcare, so obviously I would know a thing or two about diseases. Story 43. Severe infection to the chest, which was weird. Turned out the patient, a woman, had tried to shoot up into a vein on her tit because her other veins were shot. Ended up needing a mastectomy. Her breast was cut off. Attempted tragic end by drinking Drano. The thing about drinking acids or bases is that our stomachs can handle them well, but the rest of us can't. He ended up badly scarring his esophagus, needing a permanent peg to take feedings from a bag because he could no longer swallow. Also, he perpetually drooled now because he couldn't swallow his saliva. Story 44. In my wife's residency, she had an ER patient that was pretty epic. He was a farmer that was involved in some sort of equipment accident where he had broken his ankle and received a large laceration on his chest. For the ankle, the guy made his own cast out of concrete, and for the laceration, he used copper wire to sew it shut. So now he had chemical burns from the concrete and a blood infection from the wire. Amazingly, he survived. Story 45. Not a doctor, but my dad worked in a clinic that helped substances addicts a few years back. They routinely gave out free condoms to all of their clients. Anyway, there was a really nice couple who came in who were addicted to heroin. They kept getting pregnant and, maybe because of their substances use, miscarrying. My dad sat them down one day and gave them the whole safe intimacy talk and sent them on their way with an ample supply of condoms with the promise of more if and when they needed them. Sure enough, a few months later they came into the clinic having suffered yet another miscarriage. My dad took them to one side to talk to them and discreetly asked them why they had not come in for more condoms. "Oh no," the lady said. "We've still got the ones you gave us because I don't like them. I find them just too hard to swallow." Story 46. Teenager comes into the ER at 3 a.m. for earache and stuffy nose. 30-year-old woman comes to urgent care demanding antibiotics for 2 hours of nasal congestion. Young adult male comes to ER complaining he lost sensation in his feet. It's cold outside and he's working outdoors. Take a look at his legs, no sign of frostbite. Oh wow, my feet are feeling a lot better now that I'm in the warm building. Just advised him to wear thicker socks. Young adult male comes to ED for intractable bilateral facial pain. Claims it was caused by using a new soap product 4 months ago. Actually ended up being a psych patient, but still it was odd. Story 47. A patient of my dad's, a dermatologist, had a visit from a city councilman who presented with a large brown growth on the tip of his male body part. He started by confessing, "I haven't exactly been faithful to my wife recently." After a close-up inspection, my dad asked him, "Have you done any camping recently, Ted?" He replied, "Why?" "Yes, I took the boys to Arkansas 2 weeks ago." "How did you know?" "Because you have the largest wood tick on your male body part I've ever seen." Story 48. Surgeon at the local AE clinic said there was a regular patient that kept trying to eliminate themselves in really ineffective ways. For example, by taking a massive doses of pills or through self-harm. He said to us the guy was an idiot because he was diabetic and all he had to do was OD on his insulin and he'd be out peacefully. But instead they just patched him up every couple of weeks and sent him on his way. Story 49. I'm a psychiatrist and the shoot-of scene is ridiculous. 1. PT offering blowjobs for promises of crack cocaine from other patients kept getting interrupted by nurses while she was attempting. Found out she was HIV positive 2 days later. 2. Bipolar guy admitted for mania, later discharged to jail for having violation his 2 nieces. Kicker was his ex-GF happened to be admitted to the same psych ward for SCZ and tried beating him up for cheating on her by raping his nieces. 3. Dozens of PTs come to the psych ward and pretend they're tragic and or homicidal in order to get a hospital bed for a day or two. As soon as they are cured. 4. A PT who literally faked a name, Australian accent, badly, and backstory 3 days until one of the other doctors recognized him and called him out for it. Immediately wanted to be discharged. 5. Not stupid, but funny. Who jerked off and actually ejaculated during court, which was to declare him incompetent and requiring involuntary psychiatric admission. Judge obviously ruled in the doctor's favor. Story 50. Not a doctor, but when I was in college, this girl, white, I was dating, called me all freaked out that her skin was turning black. This was midday during the week. She said she was going to the hospital. My house was across the street from the university hospital, so I decided to head over to see what was up. She was distraught. I went into the examination room with her and she explained her situation to the doctor and showed him her arm. The doctor just licked his thumb and rubbed her arm. Turns out she was wearing a brand new black sweater and some of the fibers rubbed off on her arms. Story 51. Had a young woman come in just recently with a sinus infection. After telling her as such and offering a script for Augmentin, she demands to be tested for HIV. Basically, she was concerned because she's had 2 colds this winter and that's unusual for her, so she put her symptoms into Dr. Google, who promptly told her she might be immunocompromised and have HIV. No amount of reassurance convinced her, so after much crying on her part, I ran an HIV test, which was shockingly negative. Edit, bonus story on my ER rotation and had a young woman come in with abdominal pain. I asked if there was a chance she was pregnant, which she denies. Me. Are you on birth control? Her. No. Me. Then why are you sure you aren't pregnant? Her. Because of him, indicates a 3 to 4-year-old playing on a phone. Me. You do realize it's possible to have more than one, right? Came back after obtaining a urine pregnancy test to tell her she's preggo. She's unconvinced, so we do a transvaginal ultrasound and point out the nugget in her uterus. She starts crying and going on about how mad her baby daddy was going to be. Story 52. I saw an elderly woman in the ED who had a nosebleed for like 1 hour. She showed me 3 towels drenched in blood and told me that the bleeding wouldn't stop. I asked her what she had already done to stop the bleeding. I just held these towels under my nose. And did you pinch your nose? No, why would I do that? So after she was instructed to pinch her nose for 10 minutes, the bleeding miraculously stopped. Story 53. I had to explain to a 17-year-old girl and her mother that she was not in fact allergic to adult beverage, but she was just hungover. She complained that on nights when she drank too much vodka, usually on an empty stomach, that she would feel nauseous, flushed, and sometimes vomit in the morning. But it didn't happen all the time, and there were no other typical symptoms of an allergic reaction. Answer. I met a girl once who claimed this. She was one of those types whose parents' reaction to every complaint or small non-problem growing up was to get her prescribed a psychoactive substances to solve it. This equals a hypochondriac with a pretty fudge-up, unbearable personality traits. She never stopped talking about herself and things she was allergic to, presumably everything, including adult beverage. Her explanation for this self-diagnosis was the exact same. That being that if she hadn't eaten very much and then drank enough beer, she would have a mild headache in the morning. Her solution to this crippling, debilitating allergy was to drink less beer. She revealed this information like she was the first person on Earth to ever have experienced this phenomenon. Story 54. Not a doctor, but a stupid patient. I was at a local clinic because of an ear infection. I was instructed to bite down on a wooden spatula so he could see if I had any pain in my jaw. Directly after that, he was going to feel the inside of my mouth with his fingers, and I bit his finger out of a reflex from the wooden stick before. Not one of my proudest moments, to say the least. One of the most retarded things I have ever done. Story 55. Not a doctor, but I used to work as a claims examiner for a health insurance company. I once had a claim for a woman who was feeling a little frisky, so she grabbed a stapler and tried to use it to pleasure herself. She ended up needing a staple removed from the inside of her female body part. Story 56. I have a few examples. Patient who recently been diagnosed with diabetes. We needed to adjust her blood sugar levels, but she kept eating sweets. So we had a talk for like 30 minutes with her about not eating sweets and so on. She seemed to understand. 5 minutes after the conversation, she went around drinking a soda. Another guy who had a benign arrhythmia. The heart beats irregularly. He knew that he could get the arrhythmia from time to time, but as long as he didn't faint or got any pain into the chest, he could just take a beta blocker and let it pass. But he went to the ER like 6 to 7 times before he understood that we couldn't do anything. One patient came in for something, can't remember what, and when we ran tests, we found that he had a pH of 6. That is on the border of what the body can have and still have any function at all. Read, he should be dead, but he was awake and clear. We wanted to admit him to the ICU and adjust it with utmost care, but he needed to go home, to eat a shrimp sandwich. Yes, a shrimp sandwich. We sat down and talked to him and his mother for 30 minutes that no shrimp sandwich in the world is worth your life, and if there is something else you need to get help with, we can help him. But nope, he left. He came back a couple of hours later and we cured his acidosis, but that must have been a mean shrimp sandwich. Story 57. I had a patient come in one day and tell me they were struggling to swallow their medication. On closer inspection, it turned out he was trying to swallow a suppository. Had another patient come in who had recently been diagnosed with asthma to tell me she was finding her new Ventolin inhaler to be ineffective. I asked her how often she was using it, and she said every few hours. Naturally, I got her to show me in case her technique was wrong. Lo and behold, she shakes the inhaler, takes off the cap, proceeds to lift up her shirt, and spray onto her chest. Story 58. Had a patient that got pregnant while on the pill. She was devastated and couldn't understand how it happened. I asked her how she took it, P. I just used one before intimacy. Me, ma'am, you need to take a pill every day for 21 days for it to work, and then you are supposed to take a 7-day break while you have your period. P. What? I am supposed to shove one of these up my female body part every day? Me. Story 59. My mom works in hospital, and the techs from radiology always have the best stories. Last week, they had a male patient with a huge carrot up his jerk. He came from a conservative area by bus, standing cause could not sit. It was a 3H bus ride. If I ever could change my job, I want to be a radiology tech. Edit radiology tech, not nurse. Story 60. Many years ago, my wife worked in an OBGYN office. A patient that the doctor had put on birth control pills was found to be pregnant. The doctor asked if she was taking her birth control pills, and she replied she was every day. Then the doctor asked how she was taking them. She replied, I put them in here, pointing at her female body part. Story 61. Work in vascular office. Had a middle-aged woman come in with complaints of numbness and tingling in her feet and legs. Happens frequently, very painful, can't walk. Me. Do you notice these symptoms more when you're lying down or walking? Her. Neither. It only happens when I'm sitting on the toilet. I like to play games on my phone, but my legs and feet go numb after I've been sitting a while. I'm afraid I got poor circulation. Took everything I had to continue that conversation with a straight face. Story 62. I'm not a doctor, but got told to go introduce myself to a patient, get vitals, history, more info on their chief complaint, start an IV and draw blood for labs. They came in for arm pain, and it looked like they had a nasty bug bite on their arm. So story was she is a stripper, and their Adderall prescription wasn't doing the trick. So they had an idea how to make it more potent. They heard from a friend that if you crush it up, suspend it in water, and inject it, it would be more effective. Except she used tap water to dissolve the Adderall before she injected it. This ended up causing a huge abscess and infection at the site of injection. She ended up losing her arm at the elbow, so now she's a one-armed stripper. Story 63. It depends on how you want to define stupid. We have geriatric, psychiatric, and mentally retarded, developmentally disabled people that have essentially no functional baseline due to their medical conditions and sometimes the substances used to treat them. But I suspect you want to hear about normal people without common sense, and the aforementioned patients are more depressing than amusing. There was a patient with multivessel coronary artery disease who came in with a heart attack and need a coronary artery bypass graft who was only interested in hearing about EDTA chelation for treatment of his disease, and after I spent an hour making sure he had at least the appropriate medications for risk reduction for the condition, he left them in the pharmacy. There was the patient that shoved ketchup packets and pens in his urethra to get attention. There was the power of attorney who kept her mother intubated and refused to talk to doctors to at least allow us to give substandard care, and instead tortured her poor mother for days on end until lawyers had to intervene. This was due to the magical thought that her mother would just get better on her own. I can think of more. Honestly, sometimes it's funny because otherwise it would be infuriating, but it's also not that funny, especially when many of these patients are costing the U.S. taxpayer an incredible amount of money and generally increase the amount that other people have to pay as a result of their non-compliance and inability to afford the care they're getting. Story 64. Had a patient in ER with 4 long, straight, deep cuts on the back of his hand. I could see all the scenes. I asked him how he got it. He was pretty partied too hard. Well, we had a competition who dared to cut their hand with a razor blade. I won, congrats? Story 65. For the record, I'm not a medical person at all. However, my wife's best friend is a midwife, and she has loads of great stories. However, 2 that stand out are as follows. A woman who is a mere 6 months pregnant with her second child comes in screaming that she is in labor. They take her in into a side room as she's screaming still. Then it ends. She has the biggest bowel movement in recorded history, apparently, so the pregnancy had made her super constipated, and that's where the pain came from. The other was a lady who was in for a planned C-section. Everything goes well, and mother and baby are fine. After the birth, the lady is being checked downstairs in case anything went wrong. Whilst inspecting, they find some sort of obstruction, and they call another doctor to look. The doctor comes in and does her job, and finds inside this woman's female body part a set of Benoit balls. This woman had been having fun and just left them in there. The smell was apparently unreal, so vile. Story 66. Not a doctor, but med tech. I work in nursing homes, and there's a man who, instead of wearing a Depends, puts a plastic bag over his privates to catch the urine when he is incontinent. Upon discovering this habit, I informed him he could get a bad infection from doing that, and he'd have to have it cut off. He'd rather wrap it and risk infection than wear adult diapers. Story 67. Not a doctor. Work in ultrasound. Patient. We have been trying to get pregnant for 5 years with no success. Me. Are you currently on any infertility substances? Patient. No, but I have been on birth control for the last 7 years. Oh. You are currently on birth control but also trying to get pregnant. Patient. Yes, I like to know when my period is coming. Story 68. I work in an ER, and my favorite was the guy who came in because he thinks when he ate an apple a few days ago, he may have eaten the sticker on it and wanted an X-ray to see if the sticker was still in him. FYI, the material used to make those stickers is food grade and edible. Story 69. Reading all of these, I want to know how people can afford to be this stupid. I mean, literally. Where do they get the money for ER visits? I had a real thing I had to go to the ER for, and it costs so much. Plus the ambulance bill. Edit, I can't answer for when people pay and don't pay. But the skyrocketing price of healthcare being caused solely by immigrants and poor people seems suspect to me, so I looked it up. Here and here. This is 42 pages long, but very informative, and it describes how hospitals inflate costs. It seems hospitals mark up prices partly due to insurance demanding more money and partly due to, well, just feeling like it. Most of these sources describe cost variances that seem to be due to no reason at all. So while I am still unsure why some of the people mentioned here would go to a hospital for something that isn't an emergency, I can safely say they are not the reason my bills are so high. The more you know. Story 70. Probably the woman who had all the heart risk factors you can imagine. Age, high blood pressure, high cholesterol, smoker, complete occlusion of a carotid artery, and had a mini stroke before, who had chest pain, but decided to wait for 10 days before being seen because she was convinced it was her stomach. Turned out it was indeed her heart, and because she let it go on so long, she needed immediate bypass surgery and went into heart failure. A lot of patients are in such denial that heart disease will actually happen to them, when the reality is that heart disease remains the #1 cause of passing of all U.S. adults, and the sooner you get treatment, the better you do long term. Story 71. I was 16 and I was in the bath, and I felt this lump on the back of my head as I lay my head in the bathtub. What's worse is I told my mom and she felt it and sent me straight to the doctor's office super anxious. The doctor had a feel and said, "It's just the shape of your skull." I'll never forgot the look on her face as I left. Story 72. Not a patient, but a fellow classmate in graduate school. Separated his shoulder and had to wear a sling. Was not supposed to put weight on the arm at all. We'd regularly see him resting, putting full weight, though the arm, while in sling. He was later kicked out for repeatedly failing tests and underperforming. Tried to sue the school after expulsion for racism. I believe he was Indian. Needless to say, not a very intelligent individual. Story 73. I'm an ICU nurse, but this exchange happened to me when I was helping the ER triage a 40-something-year-old patient. Me. Do you have any medical history? Them. No, I'm pretty healthy. Me. I see you take metoprolol. What do you take that for? Them. High blood pressure. Me. So you have high blood pressure? Them. No, because I take my pill. Me. So what would happen if you stopped taking your metoprolol? Them. Looks at me like I'm an idiot. My blood pressure would go up. Me. Nods. So you have high blood pressure. What other medical history do you have? You'd be surprised how many people think that their daily home medications cure them so that they no longer have any medical problems. Story 74. Not a doc, but work at an ER. I was putting in charges one night, and one of the doctors had forgotten to mark the chart appropriately, so I looked at the diagnosis. It read, imagined object in female body part. I went back to joke about this and got the story. A woman came in and said she'd accidentally sat on a cactus and had spines in her female body part. The doctor, with a female nurse in the room, had to go looking and never found a single thing, including any wounds or signs of irritation. When I asked why someone would do that, sarcastically, the doctor on at the time said, well, I guess if you got nothing better to do on a Friday night. Story 75. Had a married, elderly man lodge a marble pestle in his rectum because he was bored. His biggest concern was that his wife couldn't find out. Middle-aged guy lacerated his non-dominant hand with a reciprocating saw. His dominant hand was using to cut PVC pipe under a sink. Diabetic woman said that she uses graham crackers and peanut butter to bring her blood sugar down. Yes, down. Morbidly obese young woman seeking evaluation for chronic knee pain while eating a meatball sandwich in the exam room. Story 76. Not a doctor story, but close. Spouse had a patient who ran so hard in gym class that her legs turned blued and was carried into the office by some of her classmates. Spouse noted the new blue jeans, took a damp face cloth, and wiped away the dye from the patient's leg, solving the medical emergency. Story 77. Surgical resident here had a man in his 60s who came in because he'd inserted a plastic jar full of supplement pills into his rectum. This is despite the fact that a few years prior he had done the same thing. It had perforated his bowel, and he ended up requiring an emergency laparotomy, big cut down the middle of his abdomen, and a Hartmann's procedure, cutting out his sigmoid colon, which had perforated, leaving him with an end colostomy. The loop of bowel before the part that had perforated was brought out to his skin, emptying into a bag he had to change. He had the bag for 2 years, and then another procedure to reverse it. He must have really enjoyed it. We went for a dig with a colonoscope and eventually got it out. Story 78. Till. Most doctors do what they can to help patients. The U.S. school system does not do nearly enough to further intimacy education. Some not doctors think suffering, physically or mentally, is amusing. Mental health needs to be more of a focus, and some people are just assholes. Story 79. A guy came to the outpatient clinic with swollen left ball. He said he was injected with some cajeput oil by his friend, with his consent, to enhance his performance in bed. I'm a female medical intern, and I tried so hard to keep my expression as neutral as possible. Story 80. ER nurse rather than doc, and it's hard to fathom the stupid that we see. Woman came in for an upset stomach. Had been prescribed antibiotics recently for a UTI, and decided to take them 4x per day instead of 2x because she thought it would work quicker. More chest pains caused by meth or plant substance that I can count. Someone called 911 and had an ambulance bring her in because her Implanon birth control was hurting her arm. Another 911 PT was a woman who decided to use a dish scrubbing brush as an intimacy toy, and now her female body part hurt. Eye pain after welding, without a mask. Guy had just gotten a kitten, and it scratched him. Showed me 2 cuts, less than 1 centimeter long, and not even broken. The skin. Teenage girl came in by ambulance for flu symptoms. Stated she tried to go to urgent care, but it was closed, so she had to call 911. More mothers requesting substances screens and pregnancy tests for their daughters than I can count. Fudge full-grown adults requesting pregnancy tests because the ones at the store aren't good enough. Hint, they're exactly the same as ours. Woman came in for abdominal pain. Didn't think she was pregnant, but reported not having her period in 8 months. You could feel the outline of the fudge baby on her stomach. Delivered 2 or so weeks later. Substances seeker came in with a newfound allergy to non-narcotic pain medicine. Stated they made him go anaphylactic. Had been in the ER 5 days prior without the allergy. Substances seeking mother using her 11-year-old daughter to try to get narcotics. Upset with us because we didn't give her daughter opioids for a bruised shin. More parents bringing their 6-month-old babies in for crying or spitting up milk a couple of times than I can count. Unknown rash on skin for 6 months. Had seen his PCP and even a dermatologist without improvement. Guess he thought our ER providers were bigger experts on skin issues than dermatologists. Woman who came in because she squirted during climax and had never had that happen before. Substances seeker who was upset that he got Vicodin instead of Perk 10s, as he called them. When he told his wife, she exclaimed, "Didn't you tell him that you used to take Perk 10s?" People coming in for abscesses on their arms, which just happened to be near veins, and calling them spider bites. People so stoned that you have to shake them to get them to open their eyes, getting upset because you're not giving them narcotics for their 12-10 pain. It just never ends. Answer: woman who came in because she squirted during climax and had never had that happen before. This, embarrassingly enough, happened to me. I was 26 weeks pregnant and I had never squirted before. I thought my water had broken and, freaking out, went to the hospital. My dad came in too because I was freaking out. It was one of the most embarrassing things ever in my whole life. Sorry, I know now that it was stupid and a waste of time, but it was my first pregnancy and I was terrified. Story 81. Not a doctor, but I work in a pharmacy, and the first person that came to mind was a very overweight lady with an absolutely toxic personality. She always treated whoever was with her terribly, would come in every few months with a new ad from Dr. Oz for a new product to help her lose weight that she made me place a special order for. Know what? She never shed any pounds. Story 82. I posted this a while back, but it's too good not to share again. 20-year-old girl and her fiancé find out that she's pregnant me partway through taking her history. Do you smoke cigarettes? Her: yay, about a pack a day. Me: you should definitely stop that. Her: well, my sister told me that if I stopped smoking, the baby would go into withdrawal and die. Me: what? Answer: there was a show in the UK called Misbehaving Mums-to-Be. The premise is quite self-explanatory, but there was a woman on there that smoked 10 cigs a day, but when she found out she was pregnant, started smoking 20. So when she's saying this to the midwife asks why. He: explanation: I think smoking more will make the baby's lungs stronger because they'll build up an immunity to smoking. The fact that someone thought this woman was responsible enough to have intimacy with baffles me. Story 83. I'm that patient. My dad is a doctor. As a kid, I called him in a panic because I was peeing blood. Mind you, we were in Africa at that point and he was doing development work. Told me not to flush and rushed home. Just to clarify, my dad was in the middle of a meeting with a bunch of big kahunas from FAO, UN, MSF, etc., and I ruined that instance for him. I'd eaten beets. Answer: my kid went to D.C. on a school trip his sophomore year at age 16. 16. He texted me one night as I'm sitting at a baseball game, sitting with my nurse friend, and he says my poop is red. I Googled, and it's a sign of colon cancer. I show my friend, we chuckle, and I send back, what did you eat? Friend and I say red velvet cupcake at the same time and start laughing. His text comes, though, 2 minutes later. Red velvet cupcake? Calm down, Cletus, you're fine. Story 84. Had a patient that didn't believe in Western medicine, constantly complained that the doc was bad since she never got better. We have iPads for patients to do testing before their visit. Part of it says to put your face in the center of the ring on the screen so the test will be accurate. It activated the camera so you can see where your face is on the screen. I've walked in on several patients that are confused as to where the camera is, apparently. We discharged a patient for disorderly conduct. He grabbed one of the nurses' jerk and tried to make her sit on his lap. He calls back the next day after we discharge him from one of our 2 doctors. Hi, I need to make a new patient app to see doctor number 2. I know your voice. You're dismissed. We're not treating you anymore. You ain't slick. Story 85. Not a doctor, but dental nurse. My favorite was a 30-something-year-old woman who came in for a checkup at the emergency low-cost clinic I worked at. Teeth were broken and almost black, and gums are angry swollen, bright red and bleeding by just moving her tongue against them. Needed multiple scaling hygienist appointments and a debridement. Honestly, YouTube has some amazingly disgusting videos of this treatment, but maybe keep the sound off if you don't like the scraping sound. X-ray showed she had all but her wisdom teeth and 10 fillings, root canals to try and save some teeth, and extractions for I think 3, but more if the RCT didn't work. Explained everything and did the usual explanation of proper oral hygiene. Asked her if she had any questions, to which she says, it's okay if I lose this set of teeth, my others will come through. Me and the dentist just looked at each other, probably a lot longer than we should have. No words. I couldn't think of anything to reply to that comment. I had a lot of weird and disgusting things happen at that clinic. I actually miss working there. Story 86. We had a young methamphetamine addict present with upper abdominal pain. She had a gastroscopy and deteriorated afterwards. CT showed she had a perforated stomach following the procedure, the worst possible complication, and would need emergency surgery. Despite the damage, she was not clinically too unwell, yet, despite hours of counseling, pleading, she self-discharged later that day to go home and smoke meth. Never heard about her again. Story 87. Not a doctor, but spent a semester shadowing doctors in the emergency room in college. There was a man who came in claiming he had shoved a pill bottle up his jerk 5 days earlier and had not been able to poop since then, so he had subsequently attempted to remove this pill bottle with a screwdriver. The doctors x-rayed his abdomen and found that there was no obstruction in his bowels at all. He had imagined the entire thing, and there was never a pill bottle up his jerk in the first place. The screwdriver, however, was very real. This man had used a screwdriver to remove an imaginary pill bottle from his butt, which caused rectal bleeding and a lot of other nonsense. Also, his wife was sitting in the room the entire time. Story 88. I used to be a pharmacy technician. We had a patient who thought he is only supposed to use Lantus pen, insulin, once and throw it away. When it was time for next injection, he used a brand new one. He was always meanie that we only give him 10 pens and it lasts him 5 days. Thousands of dollars partied too hard by this idiot, and yet insurance agreed to override early fill rejection. There was a girl who thought she is supposed to take birth control tablets only on the days she has intimacy. The vaccine will make you retard her crown in general. Story 89. Had a patient come in stating that he couldn't bend his knee. Asked him to remove his trousers so I could examine his leg. After he removed his trousers, the reason that he couldn't bend his knee was that he had a plaster cast around his knee. Checking his notes, he had been sent numerous letters asking him to come in for removal of this plaster cast, and as he hadn't attended any of the outpatient clinics, the hospital had assumed that he had removed the cast himself. Story 90. I had a mom and grandma bring their 12-year-old daughter-granddaughter to the emergency room because she was bleeding. Not from trauma or a wound. Mind you, the poor girl had started menstruating and the mom didn't want to explain what was happening or started to happen, nor that it would continue to happen, as mom and grandma well knew. On the upside, it was a very quick ER visit once they were actually seen. Story 91. I had a patient on my OBGYN rotation who was in her 50s and decided that her clitoris was actually a growth and needed to be removed. She came in 3 different times to talk to different residents over a month and would never understand that she's always had it and it's supposed to be there. We even printed off a diagram of normal female anatomy to explain. Then she started saying her urethra was actually the growth and she wanted that removed. We explained she wouldn't be able to empty her bladder without it, and she then demanded her bladder be taken out too. I think she should have been referred to psych. Story 92. Paramedic. Got a call for a stroke. Patient had facial droop and slurred speech. Says that it feels just like the last time she had a stroke, 10 years ago. Says that the symptoms came on about 4 days ago, and she knew the moment it was happening that it was a stroke, but didn't go to the hospital because she thought she could make it go away on her own. Answer. These stories make me chuckle. I'm also a paramedic and was called out for a stroke. Clearly, the man was having a stroke. Upon doing a stroke screen, it looked like the patient had something large in his mouth. Thinking maybe this guy had some sort of oropharyngeal cancer or mass. I asked his wife if this was indeed the case, and she looked at me with a very puzzled look. She said no, and then I said, what is in his mouth? His wife then says it's a peanut butter and jelly sandwich that she shoved in there. When her husband's symptoms started, she thought it was just that his blood glucose was low, so she tried to force feed this poor man an entire sandwich before she called 911. Odd job, security. Story 93. This was recent. I had a patient who was paralyzed from a low back problem that was reversible by surgery. The night before surgery, his blood glucose was getting up pretty high, like 500-ish and climbing. I told him we had to start an insulin drip to control it. Wound healing and infection risk are greatly affected, and no surgeon would do this surgery with BG this high. He then drops this line, "It is against my religion." Okay, in fairness, I get religious issues all the time, so I try to be a good doctor and ask. He states he is Catholic. It took me a fudge hour of my life at 3 a.m. to get him to take his insulin. He was ever due close to spending another day without use of his legs because he made up a religious objection to insulin. I can't fathom the stupidity that had to be conjured in order to roll that dude. Story 94. My dad is an orthopedic surgeon who does a lot of hips and knees and cries with laughter every time he tells the story of a woman who didn't understand how hip surgery works and thought they were going to take her leg off, fix the hip, and then reattach her leg. Story 95. I have one. A patient came in because she bought a jar of tomato sauce from a store which she opened by herself and cooked by herself in her apartment where she lived alone. She then tasted this sauce and looked at it and decided it was contaminated with human blood. Bought the cooked sauce to her for testing and wanted to get tested for HIV herself. Story 96. In medical school at Urology Service Clinic, I'm sent in to see a 20-something-year-old man whose complaint is that there is something wrong with his testicles. He is in a gown sitting on table, and I take a history where he tells me one of his testicles is bigger than the other and has been that way for months, and he wants them to be the same size. I have him stand and lift his gown, and his right testicle is about the size of a grapefruit, while his left is normal size. He looks at me and says, "See, they are not equal. I want the left to be big like the right." Unfortunately, the right one had cancer in it, and it had spread.